Hello, it's Thursday, July 22nd, 2021. It's Dr. Rhonda Johnson, and today I'm going to be talking about breakthrough COVID cases. Here's what we all need to know. Now, we're hearing more and more about fully vaccinated people getting tested and testing positive, and some cases being sick from COVID. That's what is being meant as a breakthrough COVID cases. A person who's been fully vaccinated who then gets sick with COVID. Now, we've heard about these 250 confirmed coronavirus cases in Cape Cod, most of them fully vaccinated folks. Then there were 9 members of the New York Yankees Major League Baseball team who were fully vaccinated and got COVID. There have been some Olympic athletes, and there's probably people that you and I know who never make the news, who've been fully vaccinated and who have recently gotten infected with COVID. And again, a lot of that has to do with this highly contagious Delta variant. So again, I want to talk about how does this happen? Well, again, none of the vaccines, the COVID vaccines, prevent illness 100% of the time. In fact, for any vaccine, there are breakthrough cases. Remember, folks, the vaccines cannot prevent you from getting infected. They can't stop the virus from entering your nose and causing you to have an infection, but they prevent illness if there has been enough time between the full doses of the vaccine so that your body can produce the immune systems, antibodies, and cellular memory. All of that takes time. It takes 2 to 3 weeks. So again, you can get COVID-19 even if you're fully vaccinated, but the vaccine should keep you from getting seriously sick. They should keep you out the hospital, off the ventilator, and out the morgue. Think of these vaccines as wearing a bulletproof vest. The vaccine is like a bulletproof vest. If you're wearing one, it doesn't keep you from getting struck by the bullet, but it should keep you from getting killed by the bullet in the area covered by the vest. So what are we talking about? How many breakthrough infections have there been? Well, as of July 12th, according to the CDC, we've had over 159 million people who have been fully vaccinated. And there have been, the CDC has documented 5,492 cases of fully vaccinated people who are hospitalized or who have died from COVID. And 75% of these folks are over the age of 65. So if you're over the age of 65, you need to be careful. Here's another important fact that's related to breakthrough infections. Experts say that if you're fully vaccinated, the chances of you getting seriously ill, from any COVID variant, if you get infected, are higher if you have certain conditions that affect your immune system, and that includes people who are cancer survivors, people who have had organ transplants, and other conditions that weaken your immune system and keep you from mounting a strong immune response from the COVID vaccines. A third important point, if you're fully vaccinated and you get infected with the Delta variant, folks, you might get sick. You might have some symptoms and fever, and you might just feel like crap. You know, everybody's COVID illness is a little different. That's what makes this so hard to predict how people are going to overcome or recover with this virus. But the symptoms of the Delta virus include runny nose, nasal congestion, a bad head cold, headache, cough, sore throat, fever. You may feel fatigue, like you are really, really tired. You may have a loss of appetite, sore throat, and a loss of taste or smell. Although some doctors are saying that they're not seeing much loss of taste and smell with this Delta variant. So again, everybody's different. But it does appear that most adults are going to feel something that lasts about a week. So if you are experiencing these symptoms, even if you're fully vaccinated, and of course, if you're not vaccinated, you need to get tested for COVID-19, and you may need to talk to your doctor about how to manage this, especially if you're 65 and up or you have complicated medical conditions. Folks, don't take chances with this. Get tested for COVID if you're having symptoms, even if you're fully vaccinated. Now, my opinion here, this is my opinion. I know I'm going against CDC guidance, but also doing this with the knowledge that everybody needs to manage their own health risk here. So you need to know what your health risks are. You need to look at any diseases, what's your overall state of health, where you live, how many people are in your household, if people are unvaccinated, where you work, who you may encounter. And again, I say, unless you know folks are fully vaccinated, just consider them to be unvaccinated. Because if you get COVID, folks, it's a battle between your immune system and this virus. And this Delta variant produces a whole lot of virus particles. It's a lot more, 1,000 times more than the original strain. So we're going to be in this COVID pandemic for a long time, it seems. The virus isn't going away. It keeps evolving, so we have to keep evolving. We have to be in the long game here. I do believe the pharmaceutical industries are going to find and discover antiviral drugs that work for COVID, like HIV, AIDS, and hepatitis C. But if you remember, it took a long time to get where we are today in the treatment of those diseases. So in the meantime, folks, we got to survive. So we need to mask up. We need to practice hand hygiene. We need to assume everyone is not vaccinated, and we need to be careful, especially in indoor gatherings. We got to start opening up the windows, putting the fans on, increasing cross-ear ventilation, just like we did before. What we did before will work against the Delta variant. Keep taking the vitamin D, folks. Keep being physically active. Keep your chronic conditions under control. Keep going to the doctors. And by all means, keep your mental health practices going too, so that you can stay in a mindset that is positive and is practicing self-care. So that's my message today. My views are my own. Stay safe, folks. And as always, have a blessed day.